Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Wilms tumor. So Wilms tumor, the first is the prevalence. So we are going to explain in brief of everything. So Wilms tumor, the prevalence is the most common primary. It is the most common primary renal malignancy of the childhood, and it typically seen in age from 2 to 5 years. It is unilateral. The genes involved, it includes the WT1 as well as the WT2, and this is present in the chromosome 11. The three chromosomal components of the histological components, it includes a biasthemal. So biasthemal is present, then comes the epithelium, as well as there is presence of the stroma. So what are the associated syndromes? Associated syndromes, it includes the VAGR. So VAGR syndromes, that is a Wilms tumor. Next comes the aniridia. So Wilms tumors, aniridia, genital abnormalities, as well as the MR, that is a mental retardation. Next is the Denys. The Denys-Drash, the DENYS, Denys-Drash syndrome. So Denys-Drash syndrome is nothing but the gonadal dysgenesis, and then it also includes the renal failure. So next comes the Beckwith. So Beckwith-Wiedemann syndrome. So the Denys-Drash syndrome is the gonadal dysgenesis and the renal failure. The Beckwith-Wiedemann syndrome, it can lead to the hemihypertrophy, as well as the visceromegaly, then the macroglossia, as well as the omphalocele, and the hepatoblastoma. Now, what is the clinical presentation of the clinical features? It includes the triad. The triad is intra-abdominal. Next comes the fever, that is disappearance of the tumor resection. Then comes the hematuria. Then we look at the route of spread. What is included in the route of spread? It can be hematogenous, and it is most commonly cited will be the lungs. And the investigation is there is a MRI which is preferred, and this is due to for the better visualization of the soft tissue in case of soft tissue details. Then the Wilms tumor, there is a crescent-shaped discrete and peripheral calcification. The neuroblastoma, there is a finely stipped classification. There is a stippled classification which can be seen, and this crosses the midline. Then as the treatment is, you have a radical nephrectomy which is seen. This is the treatment. Now what are the, so after the treatment we saw the radical nephrectomy. Then comes the prognostic factors. Prognostic factors is histology, we have the stages, and there is also the start of the chemotherapy. So chemotherapy is within the 5 days, if the adverse histological factors. Then comes the radiotherapy. The radiotherapy is within the 10 days, and the chemotherapy regimen is present. This includes the VCD, and this is a V for vincristine, C for cyclophosphamide, and also the D for the doxorubicin, and the dactinomycin. To learn and grow daily like this, please do subscribe.